Hi everyone, my name is Shannon Martell, and I am a student at Nova Southeastern University in the Doctorate of Occupational Therapy program. I am currently enrolled in OTD 8244, Innovations in Technology in Contemporary Occupational Therapy. In this podcast, I will discuss what an electrode implanted arm prosthetic is, its use, and how occupational therapists can help in the rehabilitation process when working with a client with this type of prosthetic. The loss of a limb is a traumatic event that has lasting implications that can affect the quality of life. In today's world of technological advancements, Dr. Richard Brandmark in Sweden has completed his research on electrode implanted arm prosthetics. This approach in prosthetics goes a step beyond a motorized prosthesis. A motorized prosthetic has a mechanically powered motor that aids in basic range of motion. This prosthetic would be designed in such a way that it aids the individual in simple motions such as flexion and extension at the elbow joint. Electrode implant prosthetics are more advanced due to the way that the electrodes are embedded into the skin and nerves to allow for higher functioning. Electrode implant prosthetics uses a surgical technique called osseointegration, which means living bone is in direct contact with an artificial implant instead of having tissue covering the bone. In traditional amputations with a prosthetic fitting, the living bone is covered by tissue. Therefore, the prosthetic would come into contact with only the tissue, not the living bone. In electrode implant prosthetics, the surgical process of osseointegration is used to fuse the living bone to a titanium-fitted socket that receives the electrode prosthetic. The titanium receiving socket is permanently fixed on the arm, but the prosthetic arm itself is removable. After the titanium socket is surgically set, including the implanting of the electrodes, the prosthetic arm is fitted. In contrast with a motorized prosthetic, in the action of picking up a pin, someone with the electrode implant prosthetic would have much greater success due to the increased range of motion in the elbow and wrist joint, as well as higher functioning and fine motor movements in the fingers. For someone with the electrode implant arm prosthetic, picking up a small object like a pen, coin, or even a piece of paper is much easier than someone with a standard prosthetic or a motorized prosthetic. The benefits of the electrode implant arm prosthetic are vast, including complete range of motion, fewer skin-related problems such as infections, and a more natural feel, movement, and look. Within the realm of occupational therapy, a client is able to not only gain function and use of a prosthetic limb, but occupational therapy allows for specialization for each individual. Occupational therapy is vital in the rehabilitation of someone with this type of prosthetic. Due to the increased level of mobility with an electrode implanted arm prosthetic, an occupational therapist is able to work with the client to learn how to not only use the prosthetic within the client's ADLs and IADLs, but how to use it in the exact ways the client desires within their specific environment and occupation. This is a huge advancement in the world of prosthetics that opens up many doors and opportunities not only for clients with amputations, but also within the world of occupational therapy. Occupational therapy is key to the full recovery and use with this type of prosthetic due to the high functioning capabilities that are allowed with this new technology. For more information, visit www.newsatlas.com/mind-prosthesis. Thank you for listening.